Thank you so much for waking up early, having breakfast burritos together. Part of the definition of translational research is not just staying in one institution, and so I have the distinct privilege of representing not only Phoenix Children's and Barrow, but also the U of A College of Medicine Phoenix, the Cactus Foundation, and the VA as we go forward. I'm here to talk to you about what is a concussion, what do we know about concussion, what should we be thinking about a concussion. And some people, those that are not as familiar with concussion as those of us in our room, may say, well, a concussion is one of those things that you know it when you see it, and so you can download a picture like this off the internet, but you can't tell from a single picture whether or not this particular football player is experiencing a concussion, pain from another type of injury, or just a celebration from a good play. As you continue to move through this in rugby, you can't tell if it's wallowing in defeat or nursing a concussion. You don't know if somebody might have a migraine, be intoxicated, or have a concussion. And then since we're in the fall season, you can't really even tell if a particular individual has a concussion or is just demonstrating a particular Halloween costume. I don't know the story behind any of those pictures, but I can tell you that from a single image, just by looking at somebody, you can't tell if they've had a recent concussion, are living with a concussion, or living with the symptoms of traumatic brain injury. What I can tell you is that a concussion is a mechanical event. This is a picture from the early 1920s on how they used to test football helmets. They'd put it on a young gentleman, tell him to jump into a wall, and if he was seeing stars and hearing birds chirp, that helmet wasn't doing much. Today we have helmets that have sensors in them, we have cars that have sensors in them, we even have airplanes that have sensors in them that tell you how fast the car was going, how quickly the car stopped, what the car was doing at the time of the impact. However, when you look at this picture of this automobile accident, what you can tell is that it looks like a severe automobile accident. You can probably see some of the airbags are deployed, the engine block is cracked, the windshields are destroyed, but there's no way for you to look at the scene of an accident and say, those individuals survived, those individuals died, those individuals walked away unscathed, because the outside appearance of injury does not resemble the inside of the injury. What it's important to know is that there is a disease process that is initiated as a result of those mechanical events. The disease process is essentially a re-scrambling of the circuits in the brain. This is an infographic that comes out of Pittsburgh and Children's Hospital of Philadelphia. On the left-hand side is an illustration of the healthy brain, where all the circuits in your brain are wired appropriately, are connected in a specific manner that allows the brain to function. After injury, what essentially happens is all those circuits get scrambled. You can see that those are illustrated now by these harsh angles between the dots inside the brain on the right, as opposed to the smooth lines in the brain on the left. This is no different than opening up the back of your iPhone, putting in a bunch more solenoids and transistors and wires, and then turning it over and hoping that when you turn it on, it does the exact same thing. It's the circuitry inside the brain that gets disrupted as a result of brain injury. When you disrupt those circuits, you end up with a series of enduring neurological symptoms. And you'll hear that from the rest of the colleagues that speak today, that the symptoms that can emerge follow the entire array of function that the brain controls. Those fall into cognitive domains, into vestibular or balance domains, falls into vision, into migraine, neck-related pain, anxiety and mood. From a different infographic, there's physical, sleep, cognitive, and emotional damage that can occur. The most important thing to remember about this is you don't have to have every symptom to be suffering from a concussion. You don't even have to have more than one symptom. If any of these symptoms after a mechanical injury disrupt your activities of daily living, you have a concussion and you're dealing with a concussion. What we found in interviewing some individuals is they are able to deny having a concussion because, well, I don't have a headache. You got 9 other symptoms, and so please take those into account that you do have a concussion, because symptoms are interfering with your activities of daily living. And so there is a medical definition, there is accepted definitions of brain injury. Brain injury is a complex pathophysiological set of processes. So that just means there's stuff happening in cells that affect the way the brain works. They're induced by mechanical injury, and it results in some symptoms. So there's a picture from the Mayo Clinic that shows a diagram of the brain moving inside the skull as a result of those mechanical forces. This diagram on the right is intentionally small and fuzzy so you can't read it, but basically what it's saying is what we purport to know about concussion starts all the way on the left-hand side with the actual impact and the actual event of the brain injury. It progresses towards the cellular responses, what's happening in the cells in the brain, to the network and how the circuits are disrupted, to what the individual experiences and how those symptoms in the individual then affect the community. How can I best describe to this audience what happens inside the brain? It's actually quite simple, and that is that the primary injury ripens into a secondary injury the exact same way that a banana bruises. And that's everything that I just showed you on the previous slide. That over time, that banana is going to mature, but there are ways to accelerate it. You know that if you take bananas out of a shopping bag and drop them on your counter, wherever the banana hit the counter, it's going to bruise first. Why does it bruise first? Because the peel is damaged. That peel then releases some chemicals. Those chemicals then get transmitted into the banana and accelerate the ripening process. That's no different than being hit on the head or your head hitting something. Those mechanical forces disrupt the cells and cause this injury to progress throughout the brain. Thankfully, the brain is connected in a way that allows it to recover somewhat, unlike a banana that goes on to a specific demise. When we try to image and see what goes on inside the brain, the most important thing anytime you're looking at imaging is that the left side should match the right side. So if I wasn't holding this microphone and I put out both my hands, you'd see both my arms are the same length. I've got the same number of fingers, and each arm and each finger is the same length. If I had a physical deformity where one arm didn't look like the other arm, you could say something's wrong. And so in that normal image on the left, what you're supposed to do is divide the brain in half. When you divide the brain in half, you then say, does the left half look like the right half? And in that case of the normal imaging, the normal CT scan, it does. When you have that middle image of diffuse axonal injury, the left half kind of looks like the right half, except all of the detail is missing. And when you have something called diffuse swelling, almost all the detail is missing. If there was a focal injury and a severe brain injury, something beyond a concussion, you might see more discrepancy. But what does that really look like on the histological level? So these are histological images from individuals that died at the scene of the accident and the pathology was done. When you go in and you look at the detail of the brain, what you end up seeing is destruction of the networks. You see a breaking of that healthy network into a damaged network, and primarily what the pathologists are looking at is an axon that ends up with this balloon at the end. This is no different than cars on a freeway that end up backing up when there's a single accident. These are just molecules that accumulate in the cell and physically disrupt that network. And so on the left here, we have a cartoon of what the brain looks like. On the right, we're looking down at the individual cells. The purpose of showing you this slide is to remind you that the brain part of traumatic brain injury, is not a bag of neurons. It's not just neuronal cells that make up the brain. There's a bunch of supporting cells and blood vessels. The neurons that are in blue are supported by oligodendrocytes that wrap those axons and myelinate them. The synapses between two blue neurons are supported by the green astrocytes that help that synapse work and remove and deliver molecules from the blood vessel. And then there are even microglia that act as sentries and surveil that area to make sure that the brain is acting appropriately. When you consider that this is how the brain is made up, you'll recognize, go ahead, Faiz, that diffuse brain injury is actually diffuse neuronal injury, axonal injury, vascular injury, glial injury, go ahead. And that type of injury is scattered all throughout the brain. Next one. And when it's scattered throughout the brain, depending on which part of the brain is affected, you can end up with specific neuronal deficits. those impairments that we talked about, the emotional, the somatic, and the cognitive. And so it's important to know that when you have a healthy brain, go ahead, Faiz, just guess, you're going to be just fine. That ends up being a pathological brain, we're going to end up with these neurological deficits. And that is the important point about what we conceptually understand about concussion. The medical treatment for concussion and many other diseases today is kind of like this. You get a population of people who have a specific diagnosis, let's say a potential head injury, and there might be a medical treatment where we shower a variety of drugs on top of those individuals. What we do know is that time is not going to, or we shower the drugs on them and then we wait and hope that that diagnosis clears. What we are really trying to do in the medical field is to take that population of suspected head injury, run through a variety of diagnostic tests that will allow us to separate or at least personally identify those individuals. Once we're able to identify those individuals, we can put them in specific groups. And once we have them in specific groups, we should be able to, next one, tailor specific treatments and medications to each of those individuals. And on the next slide, you'll see that this diagram comes from our colleagues in Pittsburgh, where they take into account all the potential risk factors that go into a concussion. Have you had a previous concussion? Do you have a migraine? Do you have any ADHD or learning deficits ahead of time? How old were you? Let's go back. Then there's a concussion, and for each one of those individuals, when you take them personally, you want to assess their concussion trajectory. You want to evaluate all those symptoms, find out which symptoms they may have, which symptoms are bothering them most, and then tailor treatment just to the symptoms that they are having. You don't necessarily want to treat for those symptoms that don't exist, and you want to make sure you're treating the symptoms that do exist. And so in the work that I do, it's primarily research and discovery based, where you have projects that are trying to help children return to learn, adolescents who have a traumatic brain injury and are trying to get through puberty. We are trying to help veterans who are returning to their civilian lives and dealing with a host of symptoms, the athletes who are suffering brain injury on or off the field, and then also victims of domestic violence that are probably the largest unrecognized portion of the population that are suffering concussion and head injury on a regular basis. And so with that, I'm just the figurehead for a remarkable integrated set of individuals that are trying to understand this condition, understand where we are and where we need to go, and I thank you for your attention.